Men.
Hi, how are you today?
I'm good, and you?
Good. My name is Allie. I'm going to be your nurse today, and today we're going to be performing a neurological assessment. So this is going to entail me asking you a couple questions and performing some actions to check your neurological status, okay?
Okay.
All right, so we're going to start with your level of consciousness. So this is based off of the Glasgow coma scale. So I noticed when I walked in that your eyes spontaneously opened. So you would get a score of a 4 for spontaneous opening of the eyes. And then now we're going to check for your orientation. So for the orientation, can you give me your full name and date of birth?
Timothy Sean Anderson, and it's September 14th, 1987.
All right, great. And then where are you?
I'm at home.
All right, and then who's the president?
Biden.
All right, so that means that you are alert and oriented times 4. So on the Glasgow coma scale, you'll get a score of a 5. And then on the next one, we'll do for verbal commands. So can you shake my hand? All right, and can you raise your hands above your head? All right, so you adequately respond to verbal commands. So on the Glasgow coma scale, that would be a 6 for a total of 15, and that's the highest you can get on the Glasgow coma scale. Next, we're going to move on to your cognitive assessment. So the cognitive assessment would be, we can do 2 different tests for that, but today we're going to check your mood and affect. So for that, you seem calm and happy. How are you today?
I'm well.
All right. So you adequately respond to that. So it's congruent. It wouldn't be congruent if you were saying that you're good while you're crying or laughing while you're telling me you're sad. So you congruently with your mood and affect. So we're going to move on to the cranial nerve assessment. So for this, there'll be 12 nerves we're going to check. We're going to start with number 1. So cranial nerve number 1 is the olfactory nerve. So the olfactory nerve tests for your sense of smell, and this is a sensory nerve. So what I'm going to have you do is I'm going to have you smell some different smells. We're going to have you occlude one of your nostrils and close your eyes and tell me what you smell.
Soap.
All right, and the other nostril.
Cinnamon.
All right, great. So cranial nerve number 1, your olfactory is intact. Next, we're going to go ahead and do cranial nerve number 2, which is your optic nerve, and this is also a sensory nerve. This checks your central and peripheral vision. So for the central vision, we would usually use a Snellen chart. First, I would find out if you wore glasses or contacts, and then with the Snellen chart, it will test your vision far away. So you would stand 20 feet away from the chart, and you would try to read which line you can see with both eyes, and then you would do it with one eye, and then you would switch and do it with the other eye, and then it would tell you, based off of 20/20, how far away you can see. And then for your close-up vision, we would use a chart called a Jaeger chart. And you would have that chart at 14 inches away, and you would be able to read the chart, and that would test your close-up vision. We're not going to do that today. So for your peripheral vision, we are going to test that, and I'm going to have you stand up for me. And so we're going to cover the same eye, and I'm going to have you tell me whenever you see the bunny ears, okay?
Okay. Okay. Now. Now.
All right, keep covering that.
Now. Now. Now.
All right. So that would test your peripheral vision, and we would do that bilaterally. So your vision is normal peripherally. I'm gonna have you have a seat. All right, so that completes optic nerve, nerve number 2, so everything is intact. So we're gonna move on, and we're gonna do 3 of the nerves at the same time. So cranial nerve number 3, which is the ocular motor, cranial nerve number 4, which is the trochlear, and then cranial nerve number 6, which is the abducent. So these nerves are all motor nerves, and they're going to test your eye and your movements. So first we're going to test your pupils. So I'm going to shine a light in your eye. And so just look straight ahead at me. Alright, so your pupil is constricted. So by me shining the light in the eye and then the light not in the other eye, they both constrict at the same time. So that means that they were consensual. And then next we're going to check with the pen light again, and I'm just going to have you follow the pen light, okay?
Okay.
So just look straight ahead at me. Alright, so your eyes moved congruently and they conjugated at the same time. I noticed no nystagmus, which is erratic movement of the eye. And then last thing we're going to check is I'm going to have you stare at the wall, and so this is going to dilate your pupils, and then I'm going to have you look at the pen light whenever I tell you to, okay?
Okay.
And look at the pen light. Alright. So whenever I use the pen light to follow in, both of the his eyes converge at the same time, so it was equal. So his eye movement is intact. So nerve number 3, 4, and 6 are all intact, and so I would say that pupils are equal, round, and reactive to light.
Okay.
All right, so we're going to move on to cranial nerve number 5, which is the trigeminal nerve. This is actually both sensory and motor. So for the sensory portion, I'm just going to have you close your eyes, and I'm going to have you distinguish on which part of your face I'm touching, okay?
Okay. Cheek, left cheek, forehead, chin, nose.
All right, you can open your eyes. And now we're gonna do a soft or sharp test. So I'm gonna have you stick your hand out. And so this is soft, and then this is sharp.
Okay.
So we're gonna do the same thing. I'll have you close your eyes and just distinguish which sense is soft and which is sharp, okay?
Okay. Soft. Sharp. Soft. Sharp. Soft.
All right, great. So your sensory is intact for cranial nerve number 5. So we are gonna check your motor for that cranial nerve number 5. So what I'm gonna have you do is I'm gonna put my hands against your face, and I'm gonna have you move your jaw side to side. All right, and then push against me. Like open, there you go. All right, so the motor is intact. You've got good strength bilaterally. So cranial nerve number 5 is completely intact.
Okay.
So we're gonna move on to cranial nerve number 7, which is your facial nerve. So this is gonna check for symmetry, and this is also both a sensory and a motor nerve. For this one, for the sensory, we would usually use like a salty and a sweet test, and that would be tested on the anterior 2/3 of your tongue. We're not gonna do that today, but we can test your motor, which will test the symmetry. So I'm gonna have you smile. All right, and puff out your cheeks. All right, great. And then I'm gonna push against your eyebrows. All right, great. So your motor is intact. You've got good strength in your jaw and in your face. What we would be looking for would be any kind of facial drooping that would change the symmetry. So the next one we're going to do is cranial nerve number 8, which is your vestibular cochlear, which can also be called the acoustic. So this is a sensory nerve, and it tests your hearing. So today we're going to be using the whisper test. So what I want you to do is cover one of your ears, and I'm going to whisper 3 words, and I want you to repeat them. Red, white, and blue.
Red, white, blue.
Okay, cover the other ear.
Apple, banana, orange.
All right, great. So you've got good hearing, and we can also use tests like with a tuning fork, and it would test your vibrations, but we're not going to do that. So we'll move on to the next one. So we've got cranial nerve number 9, which is the glossopharyngeal, and then also cranial nerve number 10, which is the vagus, and they're both sensory and motor nerves. So for the sensory portion of cranial nerve number 9, you would usually use bitter tastes on the 1/3 posterior of your tongue, but we're not going to do that today. And then for cranial nerve number 10, the sensory is a feeling of like fullness and like uneasy of your stomach.
Okay.
For the motor portion for cranial nerve number 9, the glossopharyngeal, I'm gonna have you stick your tongue out. All right. So the uvula came down whenever I asked you to stick your tongue out, so your motor is intact.
Mm-hmm.
And for the vagus, we would test motor would be the gag reflex, but we're not going to do that. But we can also test your swallowing. So I'm going to have you swallow for me. All right, and cough hard. All right. So those are intact. So nerves number 9 and 10, the glossopharyngeal and vagus, are both intact. We'll move on to cranial nerve number 11, which is the spinal accessory. That's a motor nerve, and so that tests the strength in your neck and your shoulders. So what I'm going to have you do is just push against me, like turn your head towards me. There you go. And there you go. All right, and shrug your shoulders. All right, great. So you've got good strength in your neck and your shoulders. So the cranial nerve 11 is intact, and then the last nerve is the hypoglossal, which is cranial nerve number 12, and that's a motor nerve also. So for that, what you do is I'm gonna have you stick your tongue out really hard. All right. So his tongue is midline. He's got good strength, and then I'm gonna touch your cheek and stick your tongue in your cheek. All right, other side. All right. So you've got good strength in that as well, and it's symmetric. So all your cranial nerves are intact. So we're gonna move on to the motor strength assessment. So for that, you had a good strong gait when you walked in, but also we can test a couple other things. So what I'm gonna have you do is stand up for me and stick your arms out straight. All right. So what I'm looking for is any drift or dripping, and looks like you're equal in strength, so that's intact. And then I'm gonna have you stick your arms like this and push against me and pull against me. All right. So that tests your tricep and bicep strength. So you have equal strength bilaterally, so it would be a 5 out of 5 in strength. Also, we can test your legs. So what I'm gonna have you do is push your knee up against, all right, other one, all right, so you've got equal and bilateral strength, 5 out of 5 in your legs. And the last thing I'll have you do is have a seat, and we would test you. I'm gonna have you stick your legs out and push on the gas and pull up. All right, so this tests for the dorsi and plantar flexor. So you've got good equal strength bilaterally, 5 out of 5, so good movement and strength in all extremities.
Okay.
The next thing we can do is the sensory assessment. So we already did your face, and we can do the body now. So kind of the same thing. I'm going to have you close your eyes and tell me which part of your body I'm touching, okay?
Okay. Left arm, right leg, neck, right arm.
All right, and you gotta open your eyes, and we're gonna go ahead and do the soft and sharp with that again. So just tell me when you feel soft and sharp, okay?
Okay. Soft, sharp, soft, sharp, soft, sharp, soft, sharp.
All right. So we could also use different temperatures. If you were unable to feel, we can use hot and cold water to test that as well. So your sensory is intact. And then next we're going to do your cerebellar test. So I'm going to have you stand up, and for this test it is called the Romberg test. So just stand up straight with your feet together and hands by your side, and you're standing erect, so the cerebella helps you stand straight. So you are balanced with your eyes open. There's no drift and there's no swaying, so I'm going to have you close your eyes while I support you. All right, and so your cerebellar is intact. There was no drifting and you have good balance. And then we could also test your coordination by having your heel go across your shin of the opposite leg. All right, good. So you've got good, adequate coordination, and then you can have a seat. So the last thing that I would test, we're not going to test them today, would be your reflexes, but we can test the biceps, tricep, brachioradialis, your patellar, your Achilles, which is behind the ankle, and also your Babinski. So these positive reflexes mean that your spinal cord will be intact and you have no neurological deficits.
Okay.
All right. Well, thank you so much for this. I appreciate it. We completed a full neurological assessment.
Thank you very much.
Thank you.